Okay. Assalamualaikum warahmatullahi taala wabarakatuh, and a very good evening to everyone. So my name is Mazawawi bin Muhammad. So I'm going to explain about the pulmonary stenosis or PS. So as you can see from this picture, the pulmonary stenosis. So it's from its name. The stenosis means is narrowing. So the narrowing of the uh, the pulmonary artery areas. There's a few type of the pulmonary stenosis. The first one which is valvular. That means the stenosis is occur at the valve. So basically the valve is restricted to open. Is like it's not like the usual valve is open like a normal size, but in this valvular type of pulmonary stenosis, that means the opening of the valve is restricted. So it's only allow some of the blood will enter into the pulmonary circulations. So usually the pulmonary, usually the stenosis at the valve is usually associated with Noonan syndrome. So next type of pulmonary stenosis is can occur at the subvalvular area. It means before the valve. This is the place which is before the valve. So it's caused by the hypertrophy in infundibular muscle. So it's usually associated with the defect which is ASD. Usually they have ASD. So next type of the pulmonary stenosis is supravalvular. So for the supravalvular is above the valve. Is after the blood passing the valve, there's some narrowing or stenosis area that might be from at the branch of the pulmonary artery, right or left pulmonary artery. And usually for the subvalvular stenosis, they're associated with Williams syndrome, Ehlers syndrome, and congenital rubella syndrome. So the clinical features that pulmonary might have is for mild to moderate pulmonary stenosis. Usually they are asymptomatic, but when you put your stethoscope at upper left sternal edge, you will hear ejection systolic murmur. This is because the pulmonary stenosis. So the murmur can radiate to the back. And in case of severe pulmonary stenosis, because of the, as you can see, because of the narrowing of the valve or narrowing of the area where the blood need to go to the lung, so it causes the less blood to go to pulmonary circulation. So that's why the patients might have poor effort tolerance, exertional dyspnea, and also because of this narrowing, they might have from the physical examinations, they have a parasternal heave and also palpable trail. In case in some of the very severe case of pulmonary stenosis, or we call it critical pulmonary stenosis, this critical pulmonary stenosis basically can cause failure because from the name is critical pulmonary stenosis. It means that the stenosis is very severe. It's only allow small amounts of blood to pass through the stenotic area to go to the lung. So case of very severe lah. So in this critical pulmonary stenosis is usually occur in neonates or newborn. So where they might have present with cyanosis. Usually pulmonary stenosis might moderate and severe, usually not presented with cyanosis, but in this critical pulmonary stenosis, they will have a cyanosis because of in the newborn, as you all know, in the newborn, the foramen ovale needs some time to close, right? So the blood from the right atrium might shunt to the left atrium. So that's why when the deoxygenated blood go to the body, they might have presented with severe cyanosis. So usually this cyanosis might be present in the neonate because they might have a coexistence with cardiac defect such as atrial septal defects and also ventricular septal defect. So when you test for the SpO2 level, the oxygen perfusions or SpO2 will be reduced in this because of the stenosis. Okay. Next, for the when you do the investigations, you can see from the ECG, they show high right ventricular hypertrophy in severe PS. Why they get the right ventricular hypertrophy? Because when the pulmonary circulations receive less blood compared to the normal, so the right side of the heart will compensate by increase the muscle thickness, or we call it hypertrophy, to increase the blood goes to the lung. So as you can see from the arrow here, there's a congestion of the blood before the stenosis area, and they need to pump harder to increase the blood goes to the lung. So from the chest X-ray also, we can see the right ventricular hypertrophy because of the increase the right side of the heart to pump. And then second, in the chest X-ray also, we can see that post stenotic pulmonary artery dilatations. This is because when there's a narrowing, the cardiac, the right side of the right ventricle will increase the pump, right? So increase the contractility. So the blood will go to the lung, will increase in the velocity because the narrowing of the stenosis area ni. So that's why that can cause the pulmonary artery dilatations is around here. Okay, so the chest X-ray also, we can see there's a oligemic lung, which is reduced because of the reduced blood to the lung. As we all know that the stenosis area causing the blood to enter the lung is less compared to the normal, and that's why we can see there's oligemic lung. That means there's a less perfusion to the lung. So next investigation we can do is echocardiogram or transthoracic echocardiogram. There's we can see from the echo that there's a turbulence across the right ventricular outflow tract is seen on the color flow Doppler. Because of the stenosis area, there's a turbulence of the blood flow at the right ventricle. So for the management, for the asymptomatic mild PS, usually there's no treatment required. But for the valvular pulmonary stenosis, we can use percutaneous balloon valvuloplasty to increase or to widen the stenotic area. And then for the branch or peripheral pulmonary artery stenosis, it may respond to balloon angioplasty with lobes at rate, and this might need to do stent implantations if in this in severe case. Okay, I think that's all for the pulmonary stenosis. Okay, thank you.